One. Hi, I'm Dr. Ladona Tornabene from the University of Minnesota Duluth, and I'm so pleased to have with us today students that are involved in our undergraduate underrepresented research program, UURP, here at the University of Minnesota Duluth. This program was really envisioned by our faculty member, Dr. Marzelle Gray. And basically what it's about is it's to provide undergraduate public health students with research experience and faculty mentorship, as well as opportunities for professional growth and development. And priority is given to those students who are first generation and who or form an underrepresented group. I'm excited to have with you today a couple of our students from our first go around at this, and I want to introduce them to you right now. It's Sara, Hildreth, and Mary. Go ahead. I don't want to mess up your last name. You know, Dr. Tornabene and names. Go ahead.
Okay, my name is Mary Parsatoon, and I am a junior in the public health program and a UURP participant this year. This year, I conducted a research program regarding waste management, and I joined UURP to further develop my research skills that I gained in Dr. Hansen's public health courses and other various jobs. UURP provided me with an amazing opportunity to continue the research that I've been conducting in previous years virtually by allowing me to create and conduct a new research project on my previous research experience. So this year, I conducted and created a research project with Dr. Hansen called Waste Management in Dining Facilities Across Universities in Minnesota. The purpose of this study is to compare how different universities handle waste management during the COVID-19 pandemic. I conducted a survey that was sent out to members of the Minnesota Student Sustainability Network, which is an organization of sustainability leaders from different schools across Minnesota. After analyzing the data, I found that universities are educating and managing waste among dining facilities has changed due to COVID-19. And some of this is due to fewer students being on campus. The graph below is a great example of how this has changed. The graph shows that a majority of universities had to change the location of where leftover food goes due to COVID-19. I enjoyed my participation in UURP and was able to present at the National Conference of Undergrad Research due to this program. I also gained a job position at the UMD Office of Sustainability through my research this semester, and will continue this research project through the office in next years.
Well, congratulations, Mary. That's fantastic news. See, folks, what happens when you do things live? I mean, you just learn all kind of amazing things about our students from the University of Minnesota Duluth. Thank you so much, Mary, for sharing that. That was very well done and very informative. Sara, I know you and I worked together quite a bit over this past year, and it has just been such a joy and a delight. And I want to turn the screen over to you. Go ahead.
Hi. All right. So hi, everyone. My name is Sara, and I am a current junior at the University of Minnesota Duluth. I kind of jumped right into this research project. As Dr. Tornabene mentioned, I have been doing a lot of work with her. And I think that the best part about this is that this whole research project, we have been able to just match energies and been put all our hearts into this research. And it's just awesome to see how far we have come and just made this a reality. So the UURP has made that vision for us a reality. So my research is the one titled Arts and Health. It was developed to assess deep-seated interest among undergraduate students at UMD regarding the topic of arts and health. Arts and health can be defined by the National Arts and Health Framework as the practice of applying arts initiatives to health problems and other health promotion settings. In order to assess this deep-seated interest, we gave out a 7-question survey with a corresponding Likert scale to the undergraduate population at UMD. We can define deep-seated interest as having an established interest, and the reason we wanted to do this was so we could further tailor interest to students that were firmly established in their interest in arts and health. And this was calculated by assessing what majors consistently answered on that Likert scale, a 4 or a 5, or true for me and very true for me. There were a total of 78 majors who completed the survey. And of those, the most interested majors are shown at the bottom of the poster. The middle graph is showing the number and percentage of students who answered each questions within the survey. And the results from the survey will be used to inform future interdisciplinary arts and health curriculum within the public health program at the University of Minnesota Duluth, as well as tailor outreach to interested students. Doing this research project and being able to be involved in the URP was so fun, and I'm so excited that I get to further continue this work on. We have some things up our sleeves, so that'll be exciting. Along with this, there's actually an arts and health now being offered at UMD, which Dr. Tornabene will be teaching, which is very exciting. And then we just hope to have more arts and health stuff at UMD as it combines, and I would love to continue working with it as it combines a lot of my passions. So yeah, that's a little bit about that.
Thank you very, very much. We appreciate it. I appreciate the energy that you both bring and the work that you've both done to further these topics and a deeper dive. And I just want to acknowledge that I will reach out to Jocelyn and I know she's not able to be with us right now this morning, but I understand that both of you had some involvement in her research. Do you want to talk a little bit about that, either one of you? Mary, you want to go first?
Sure. Yeah. So I was involved in participating in Jocelyn's survey regarding chronic kidney disease, and she did a great job with her survey. It talked a lot about chronic kidney awareness and what the public knows and doesn't know about this. And so by realizing what I don't know about chronic kidney disease, I was able to further my education on this very important topic.
Sarah, I understand. Thank you, Mary. I understand that you participated as well. Do you want to?
Yeah, I also participated in Jocelyn's research. I think that it was a survey, and I think that just having all this information thrown out at me made me realize how unaware I was myself of chronic kidney disease. So just her bringing that knowledge to UMD students is very cool to see that.
Well, that is, I mean, I appreciate y'all taking the time to do that, and also for your weigh in on that. And as you can see here in the conclusions, that she said that overall undergraduate students are somewhat aware of chronic kidney disease, which shows that they have a low level of awareness in that topic. Well, I appreciate both of you being with us today, and I thank you so much for your time. And thank you all for attending that are listening to this for the Minnesota Public Health Association conference. We do appreciate that. So thank you very much.